Yeah, Mr. Josie John has also joined. He's just switching on his camera and mic.
And what about James?
Yeah, I'm just calling him. Uh, Mr. Josie John, I request you to please switch on your camera so that uh, all our attendees and our other panelists can interact with you. Mr. James will be joining in another 1 minute.
Do we wait for him then, sir?
Josie John, your voice is
Josie, your voice is not clear.
so
It's
I think
echoing.
you need to reconnect your audio.
Mr. Sir,
No, no, sir. It's echoing. You
hello.
need to reconnect your audio. No, no.
Mr. Sarkar, can you listen me properly?
Yeah. Your voice is very clear.
Okay.
Are we live before the audience, or we are yet to? We are up backstage.
No, no. You're live, sir.
Can you hear me now?
Yes,
Yes,
yes.
yes.
Yeah. It's very clear. Very clear.
Should we start with our introduction at least, so that our James have also rejoined.
Yeah, okay.
Difficulties. Sorry.
Okay, no problem. So should we go live?
Yeah, let's do it.
Okay. Namaste and good afternoon, everyone, and good afternoon to all the eminent panelists over here. While the subject what we are discussing is about the health and safety in the real estate industry post COVID, but we have seen the COVID has given a really shocks to the entire globe, and one thing that has emerged out of this situation is employee wellness, health and safety, and technologies of the paramount importance. So without wasting much of time, I would like to take up this session as I'm very keen to understand from the eminent speaker that how the industry is going to take over the new challenges post COVID, or during the phase of this COVID. So before I start my questions to the respective panelists, I would like to invite all of them and request a short introduction from most of individually all of them. So first, I would like to call upon James to introduce himself.
Well, hi. Can you guys hear me? First off, can you hear me?
Yes.
Okay, good. I was having all kinds of microphone problems. All right. And I'm not going to blame my employer this time. Anyways, I'm Jim Thorne, and I am the head of HSE for the Reliance Project Management Group. It's now been folded into another group, but we'll leave it at that for this moment. And I deal with the construction aspect in all the heavy industry and in new construction. COVID has impacted us quite a bit. I think that one of the big changes that we're going to see with this is that in our industry, in EHS, we're going to see a real sea change toward more of the health aspect of our jobs. And we're going to see more attention to employee wellness, employee hygiene, employee nutrition, immunology. I mean, we're going to see a lot of things, and we're going to have to educate ourselves or become better educated about a lot of these aspects. I've always said that HSE was a great big S, a small h, and a small e. Well, I think the H is going to grow in stature as we go forward. I really do. So that's my intro.
Over to you, Josie.
Good afternoon, everybody, to panelists as well as those who are listening in to us. My name is Josie John, and I'm the corporate safety head at Tata Consulting Engineers. I am a civil engineer by training, but over the past 20 years, I've moved into safety, health, and environment while I was working in the Middle East. And Tata Consulting Engineers is engaged in the engineering, design, and project management services across a broad spectrum of industries. Most people, when we say that we are from TC, they mistake us from TCS. We are not in the business of TCS, which is entirely into IT. We are into the non-IT sector, all infrastructure projects, the power sector, in the hydrocarbon, buildings, roads, sewerage system, water supply systems. And these are the areas that we are engaged in. And COVID has been a huge challenge. As a project management consultancy, we need to ensure that construction sites are up and running post-COVID after the relaxation started. But at the same time, we need to ensure that work carries on in site. That was a huge challenge for us. I would put it like this, keeping one hand tied, because we have to keep the COVID virus away from our construction sites, defending ourselves, and using the other hand, we still had to progress with work. Thankfully, all our sites are up and running, and which is a good sign, and which again shows that the economy is also picking up. So that's in brief about me and Tata Consulting Engineers. Thank you.
Finally, to you, Navindu.
Yeah, hi everyone, the complete panelists and the people who have joined a live session of this. My name is Navindu Bhushan, and basically a mechanical engineer, done my post-graduation from IIT Delhi, and having more than 2 decades of experience into the industrial project management aspects. So while executing, multiple projects, in the various countries in India, part of a lot of parts of the India, the safety is one of the main factor when you do the execution part of in the construction field. COVID situation, this is going to bring a lot of changes. What I see as far as the future is going to be. I see the labor aspects is going to change. I see the productivity change. I see it will have implication or in the digitalization of the construction industry. I see multiple places where the implication of COVID-19 will have impact as far as the new coming industries are concerned. And we will discuss more during this session. And I look forward for a active interaction during this time. Thank you, Abhijit.
Thank you so much, Navindu. And now I start my session. And my first question is to all three of you. As each of the organization has faced different challenges, maybe to an extent, most of the challenges would have been uniform, but certain challenges were unique and different. So I would like to start off from James and then go from Josie to Navindu. My questions to all three of you is, how did you create a very robust plan to ensure that the business is as usual? And in terms of the recovery plan, what was your measure to ensure that you have a very robust and a very trusted recovery plan? So I would like to start off with you, James, and then maybe I will move to other speakers.
Well, as far as the recovery plan, just let me take a drink of water. I had been through the SARS epidemic, avian bird flu, camel flu, everything. When I was in the Middle East, like Josie, I was in the Middle East a long time. And then when I was in Korea, we had a couple of outbreaks that came there too. So when this first came up, I started tracking this in early February. And I started trying to warn people, and everybody thought it was Chicken Little that I was saying the sky is falling, the sky is falling. And I started talking to people about being ready for some force majeure closings and things like that. And then all of a sudden, bang, it happened. We had no recovery plan. We really didn't. We had to do most of it on the fly. And the reason is a lot of it is because in risk management, one of the things that I've found in particular this part of the world is that people tend to minimize the risk potentials, especially when they're looking on a 5x5 or a 6x6 risk matrix, and they want to minimize that at all possibilities. So when we got hit with this, a lot of it was on the fly, and it was a big involvement with all the HSE groups, with the medical management teams, with the HR teams, and everything. And our first concern was stopping transmission of the disease. So of course, everything closed. We shut down every job site that we had. And then we locked up everything tight. So the strategic operations that we had in places like Jamnagar, where we have an oil refinery, which is actually crucial to the Indian marketplace, we locked it down. Now, we're fortunate that the company I work for has a lot of assets and a lot of means, and they have their own township. So there were some lockdown policies put in place that basically said, nobody can come in or out. You have to work shift work. We changed from having 3 shifts a day, 24 hours, to having 2 12-hour shifts. We did a lot of things like that. Once we pretty much got a handle on controlling the introduction of the virus to the workplace, then we started looking at means to restart the construction processes. And a lot of that was bringing in employees, housing the employees, feeding the employees, and keeping them on site. And of course, this was after testing and after quarantines and everything of that nature. So we have set up some special quarantine facilities. We have lots of testing that goes on. In fact, some sites are being tested almost every day if they have to go outside the fence. But the most critical thing that we've done is not allowing any insiders to come into the construction projects unless they're housed in one of our facilities and they've been quarantined and they've been tested. And it has kept the incidence down tremendously. Now, very, very few cases. And what we found was, by doing the tracking, is that the majority of the cases that came in were people who had had outside contact. Sometimes we didn't know about it, or in facilities where the people were not housed inside of our man camps or inside of our townships. And we did have a lot of outbreaks there. So then we had to have another recovery plan, which was, how do we manage these facilities? So what we came up with was, it's daily testing, a lot of social distancing, which is very tough in construction, because when you get a welding crew together, there's 5, 6 guys all in there. So one of the suggestions that I came up with them was, take these crews that you have that work together, house them together, transport them together, have them eat together. And we started to do a lot of things like that. And that also helped with our recovery plan. Of course, providing transportation back and forth, providing the food, big logistical challenges. And we had to get a lot of people involved on this. But right now, I would say that we're probably, while we have every job site working, we're at only about 25% of the strength that we had at the beginning of the year when it comes to the construction processes. So honestly, it's still a process and work, because one of the things that we really fear, and it's written into our recovery plan, is the second wave. When that second wave hits us full force, it may be worse than the first one. So we're continuing on with this same plan of locking down, isolating, testing, and keeping people inside. Now, of course, we can't keep people inside if they want to go home. A lot of guys left and went home to their home villages and their home places, and we don't know when they'll come back or if they'll come back. So we're working with a lot of shortfalls too, but the recovery plan is fluid at this point. I hope that that's the answer you're looking for.
Exactly. Thank you so much, James. Over to you, Josie. Though you touched upon a bit while you introduce yourself, but I would like you to bit elaborate that.
Yeah, thank you, James and Abhijit. Now, at Tata Consulting Engineers, we were, as we have more than 100 and odd projects running on different parts of India as well as overseas. And the most affected was most of the projects are based in India. So in India it was a very short notice where the whole announcement was made for the lockdown, and then it was a scramble. People had to madly run back, on construction sites. We had sites which had 2,000, 2,500 workmen also. So they all wanted to go back home. But that was a big challenge. We could not let them go back because there was no proper transport, etc. available. They were asked to stay on in their respective labor camps, but some of them still somehow managed to slip out and they wanted to get back to their villages. Essentially because their contractors were not paying them. They were the smaller subcontractors. So what we did was, initially since the lockdown was announced for 3 weeks, we said, yes, everything goes back, but there's going to be a stage when work is going to restart. And there we decided that we adopt a PPMR process, plan for the actual reopening. What all are the factors that need to be considered? We need to get the place ready. What all physical factors, arrangements need to be made? We had to ensure that considering the construction site as an enclosed zone, we should allow a situation where the virus will not enter that zone. So we had to keep the virus out of the premises. So have systems where we will be monitoring people using the Arogya Setu app, and also having a doctor check them even as every person started coming in. Have them check their temperature. So all this physical infrastructure was put in place. And then also to set the place up, keep the entire place running, so that people are not in a situation where they have to encounter with the virus. And then the people who would be staying on the camp. So we put together a safe operating procedure, standard operating procedures for the handling post lockdown return to work procedure. And it was made in a very pictorial format, and we put it up on our Tata Group website, and it was open for everybody because everybody was trying to figure out what has to be done. So it was available, and it has been approved or accessed by many around the world too, and they've used it. So the next phase was to actually get the actual performance. So from the planning, we moved on to the performance. People started coming back, and then to check whether the systems were working. We did a mock, we call it as day zero, to ensure that what all we have physical arrangements have been made is in place. Like checking whether the rooms where earlier workers used to be crowded, we had to ensure that not more than 5 workmen were allowed to stay in a room. So almost half the people had to be taken out. So the number of people who were allowed initially to come back, also we restricted only about 30% of the entire workforce. Then we also had to check whether all the offices were sanitized, the cooking areas, food storage areas, every element, every side of a construction site had to be ensured that these requirements are met. Now, as a project management consultant, work is carried out by the contractor who is reporting with the client, and working closely with them was also very, very important. And then from the performing phase, then we started to have a daily monitoring of what was actually happening, because people were not used to these new regulations, the new rules that have come in. And whenever there is a change in rules, there's always a resistance. Why should I do it here? And many of these people who had come back to work, some of them were not the original people who are working there. It was a new set of people who had also come back. And they're coming from construction labor. We know are generally people from an agricultural background, not very working in a strict rule-based environment. So there they come in. And it took a little time. So even for queuing up for food, we had to put marks. Every 2 meters a circle was drawn. We said you have to stand in this queue. So even the wash areas, the bathroom areas, everywhere we needed to ensure that proper social distancing was maintained. So every day there was a team available who used to go around to check that what is agreed on the procedure was actually being followed. Then this monitoring was also happening, and then we needed to review. And COVID being the kind of a virus that attacks the whole world, the information that was coming on how to manage it was also changing every day. That was a big challenge, because on one hand you have WHO, you have the state governments, you have the central government, and then voluntary agencies also coming up with information. So we need to put all this information, club it together to ensure that there's a via media with which we can go forward. So many of the restrictions or recommendations which were there in the SOP, we are also very clearly said is that based on the local government regulations, you have to incorporate whatever is required there. As I told you, we work across the country and we also work across geographies. So when you look at it, that huge challenge was there. And at the same time, you have to remember that all the equipment was also abandoned when people left the place. So going back to the equipment was also a challenge because the equipment had to be cleaned. The mechanical operations of the equipment also had to be looked at because it was lying idle for almost 2 to 3 months, and then we had to get restarted. So the equipment operators and the servicing team worked to ensure that there will not be any unwanted incidents when they start operating the cranes and the lifts and other kind of equipment. And even the storage areas had to be completely sanitized. All the equipment had to be sanitized, and there was a special team also made available so that the sanitization kept happening. So as we've seen down the line, the next challenge was when the COVID cases started getting reported. So what do? We immediately engaged with the local authorities, the health authorities, and COVID care rooms were also prepared in the labor camps itself. So there is quarantine facilities available on the camp itself. So working closely with the health authorities, even that was also brought under control very quickly because contractors were willing to provide those quarantine facilities. And in fact, there was not a single labor who had to be hospitalized or, where he needed oxygen support. And post that, again, ensuring that the social distancing norms, construction industry, it's not very easy. But still, we went around, had people talking to them and ensured that lifting and shifting, people don't stand together very close, but maintain distances. And the benefit that the contractor finally said is we find that we have to use lesser manpower, but we are getting more productivity, which I think was very good for them because they're saving money. So at the end of the day, COVID has a lot of pluses which has brought in, as well as the negative. The minuses are the additional efforts that have gone in to train the people, teach them how to behave in a responsible manner. So this was a challenge, and till date, I would say that we have been able to have all our sites back and running. We have up to 3,000 people on a couple of sites, working, and things are going on smoothly. And we hope that going ahead with COVID being present, we'll still have to find out ways and means to work with COVID, as I said, one hand tied, working one hand to ensure that productivity is also in place so that the economy of the nation is also getting supported. So, thank you.
Thank you, Josie. Now over to you, Novendu.
I think we lost him here for a minute. I blinked off for a little while too.
Okay. So before he joins back, I will get back to you. Okay. He has come. Novendu, can you hear us? Okay. Anyways, I think he has some technical glitches. To you, James, as we all know that COVID has taught us one thing which is very crystalline clear, that employee wellness is going to be a paramount.
Can you listen me?
So no, what I was trying to say, okay, I will come back to you. Novendu, are you able to hear us?
Okay. Yes,
so
I can
the
listen.
question which I left to the other two eminent speaker, you can also continue with your view, is that how did your organization encounter the challenges and what was your recovery plan?
Okay, working in a BSF organization, which is more or less owner-driven organization, we have different issues at the different countries. We are working in a different places. Some of our sites are going in Malaysia, some in Singapore, and some in India. Can you listen? I can see myself, but I do not know.
No, you are. We can see you. I can see you. I think.
Okay. So the circumstances were different in different countries. As soon as this issue of COVID started picking up, different government had different regulations, different plans. We started recovery plans or the taking actions, the plans in March itself. From the offices, early March itself, the circulars were getting started. Considering the newses which have started coming from our China plants. So those things have started. China has geared up much fast. They have not closed the complete site operations, but in India, we were forced to close some of the sites fully at the starting time. In 1 month itself, we have made our recovery plan. We took some time for shutting some of the plant because it required some way of shutting the same. It cannot be abruptly closed. Some of the places where we were working inside the plant had multiple difficulties because those workers were operational workers. We also had issues because our engineers were restricted to fly from one country to another. So a lot of restrictions have come in terms of the mobility of the people. Even for the contractors who were working in Singapore, their project managers, their workers who were coming from Bangladesh and Sri Lanka, India, they were stopped at their respective countries. So we felt heat, from last 3-4 months on those aspects. If you see our sites at Europe and America, the number of the people working over there has definitely reduced, not more than 50%. So, some places only 30% people were working, and some places only 50% people were working. But not no places I have found where more than 50% people are working. So, really a different type of the impact in the different countries, considering their local issues, their implications, and all. Now, with the 6 months gone, I think organization in all the places have matured enough. The construction sites have started, operations have started. Big implications. We are bringing digitalization into the construction multi-fold now. Those things were getting done from last 1 year, but now the efforts on those aspects have increased. So efforts on the digitalization is going to be increased in few time, as well as considering the effect of supply chain on these type of the aspects is also getting evaluated. So this is my take on the COVID-19.
Thank you, Navendu. Coming back to you, James, during this period of pandemic, one thing, most of the industry have realized that, even those who were on BAU or who have gradually started reopening, employee wellness and hygiene is of a paramount important. And it is not that, many organizations have never emphasized on these kind of parameters, but today the demographic of health and safety is altogether different. Though we have many corporates having an individual vertical which takes care of or which is responsible for employee health and safety, coming out with timely program on health safety, ergonomics and other things, whereas some of the company as a matter of compliance assign it to their admin or HR functions. So how you think that, post COVID, this department is definitely going to gain a significance, and definitely most of the organization would start engaging into a guy at least who is well equipped or well competent to know what an health and safety means for an organization. Health and safety of an employee matters for the organization.
Well, I think that one of the things, and we've seen this in our organization, and I've also talked to friends in other organizations, is the fact that the people in the EHS field have to be very business savvy regards the industry that they're in. They have to understand the industry. They have to understand how it works. In the past, EHS was kind of a siloed type organization where people
Lost him. I think we have lost him.
Yeah, yes. Him as well as Mr. Bhushan.
Let's wait for
Yeah, James is back.
Coming back.
You hear me now? Like the Verizon commercial? Okay. Anyways, let me get this out before I get disconnected again. What we're finding is that there has to be a lot more business savvy, but there also has to be a lot more upfront planning. And in the past, EHS was brought into project planning way too late. I've complained about this for many, many years. We're not brought into the feed process or to the design process until they're ready to review documentation. Now, EHS is going to have to be brought into this because some of the things that we're going to have to review way before it comes up is what's in the contract language. What does it say about force majeure? What does it say about the challenges that we're going to have? What are the transportation situations? What are the living arrangements? Where are the people coming from? Another thing is a lot more and much closer coordination with HR and with medical in a lot of companies. You know, in the past, I mean, medical and HR were, you know, it was a loose configuration, but now there has to be a lot more upfront planning. There has to be a lot more communication with both those groups. Some of the other things that we're seeing, and I said this in the intro, is that we have to become smarter and we have to become better educated about the health and hygiene aspects of our workers. Now, construction is by nature hard work, and people get sweaty and people get, you know, exposed to a lot of things. And at the end of the day, the guys are not in the best of shape hygiene wise. And I've seen people who in the past, they wouldn't shower for 1 or 2 days. And now it's like we're demanding everybody has to shower. As soon as you get back, you've got to shower. We put up hand wash stations everywhere. In the past, the only place that we were worried about hand wash stations was in the canteens or wherever they take their food at. Now we have hand wash stations all over the place. But now some of the things that we're looking at is, and understanding the health aspect of it is, what are the long-term ramifications of having people exposed to all that alcohol on their hands? I mean, are we looking at an uptick in contact dermatitis? And when I say contact dermatitis, you'd be surprised how many safety people don't even know what that is. Once again, we have to go back to the health education aspect. Now, I'm not saying that we have to go and take the same classes as physicians or anything like that. But what I am seeing, and in talks that I'm having with the Board of Certified Safety Professionals and also with the ASSP, is how can we augment the health training of our EHS personnel other than industrial hygiene? Now, we have very good industrial hygiene programs that are available through a lot of places. But as far as basic health training, it's something that we're a little bit weak at, and it's something that we're definitely going to have to step up, particularly when we're having conversations with HR and with insurance and with medical staff. We have to get smart on this, and we have to get smart fast. So these are some of the changes that I see coming as far as the organizations. And I see more integration with the upfront planning. I see more integration with contracts. I've been spending a lot of time looking at a lot of our contracts and seeing how they're set up. And I'm going to talk about that a little bit more later. But you know, these are things we have to become more savvy on. And I do think that there are going to be some companies that are going to separate EHS from whatever administrative function has it under control. But I also see some companies consolidating. And instead of EHS reporting directly to the construction team, they'll be reporting through either the contracts group or be reporting through the HR group or whatever. So yes, there are going to be some changes. Predicting what they are may be a little difficult at this time, though.
Yeah, thank you so much, James. Yes, predicting will be very difficult, but we all know that the changes are bound to happen. Thank you so much. Now, coming to you, Josie, you know, this pandemic has impacted everybody. You know, it's not that, you know, the developer, the investor, the supply chain vendor, and you know, the workers and laborers as well. So now, you know, as James said, predicting anything at this juncture is very difficult. But at the same time, you know, most of the organization must have been working on some kind of, you know, short-term and long-term plan. Short term is already what we spoke about in the preliminary stages when we spoke about the, you know, return to office strategy. But as construction industry has a lot of you know, dependency on the globalization and lot of you know, challenges which have to be met with the international environment. So how do you think, you know, your organization is planning a roadmap to take care of those challenges going ahead? So what are your strategies, you know, or the core strategies which your organization is planning as a long-term case?
See, thank you. That's a very relevant question on the way forward, you know, because the whole world has changed. COVID, as we know, is a black swan event, and everybody has started thinking differently and started taking different steps or different measures. And construction cannot lag behind either, because construction is actually a real driver for any kind of economy. If there's no construction, everything else just quietens down, because even if a factory has to produce goods, you still need a building. So somebody has to stay, you need a building. You want to travel to one place to another place, you need a road. So the entire construction industry is what actually drives the economy. Now, traditionally, construction, I would say, let's look at in terms of the history of construction. It was manual, and then we find it got mechanical, and then we found the introduction of computers into the mix, and then now what we see that there's a lot of digitalization which is going on in construction, and COVID has actually accelerated the digitization process. And what we have understood is it gives you both a competitive advantage as well as an operational necessity, because projects are becoming more complex. So there's much more rapid way of how we need to have data and other kind of things transferred. And with the growth of the Wi-Fi and internet services, the digitization process is actually getting accelerated. So much so, even many companies which we have found nowadays on projects are requesting that a dashboard be made available of all the activities. So if you want to have a dashboard where it needs to be available to the owners, it has to be digitized. So this is what has really happened in the construction industry. And this is going to get accelerated, and this is what's going to happen. Digitization is going to impact construction in a very big way. So what does the digitization actually do? Digitization records all the activities. You have prepared apps for inspection. There are apps for capturing incidents and even to go through a root cause analysis. And today, since we have cameras placed on construction site, multiple cameras where we can actually see real time. For example, the owner of a company, he sits in Delhi and he's got a construction happening in down south in Kanyakumari. He has a whole set of cameras which is there, and it's up there on his screen. Sometimes it's 16 or 20 or 25, depending upon the configuration. He knows exactly what's happening on the site. So all kind of data is available. And with IoT being very commonly used, IoT-based technology is being more rapidly used in terms of equipment and even say identifying people. Nowadays you have even for example wearing a helmet. If you don't you have a RFID barcode stuck on it, and you have a sensor which will capture the information. Like these kind of things have actually come into digitization, and it's taking things much more forward. Wearables and sensors have also come into place. Like you have smart watches to track the person, including his body temperature, or if he's got any other issues, even their personal movements. It's worn on the wrist. And go tracking devices and sensors. These are also very, very common. Sensors for opening and shutting doors, sensors for actually operating equipment. Now, cranes and other heavy equipment, you have a sensor. Either it's a face recognition, or even it may be even a fingerprint. Without it, the equipment doesn't start operating. Now, another thing that has really come up is what we find is in the high-rise, people who work on high heights, there is now. They're putting an airbag on the collar. That's also become a wearable kind of a device, so that if the person falls down for any reason, there is a tracking mechanism on it, so that his collar is protected, but at the same time, information will also go saying that his the collar has been affected. So plant and machinery are these days even tracked remotely. Satellite tracking, especially when there's a site with multiple cranes, for example. I remember on one of our projects, when I was working with Larsen Toubro, there was 15 tower cranes. Well, it was the Dhirubhai Ambani Convention Center where James was there from the client side. And we had a satellite tracking system to understand whether the cranes were working correctly, that there will not be any collision between the cranes, etc. Remote control of equipment is also done. Distance measurement using lasers. So all these are use of technology. Underground detectors, like cable detectors, which are also there. And now other kind of material also can be detected using these kind of detectors. Then we find something which is commonly going to happen is the use of drones. Drones to do a LiDAR survey. That is, for example, you want to lay a new railway line. You do a LiDAR survey using a drone, and you determine the path of the road or rail track that has to be done. Sometimes even a drone is used for inspections in remote places. In very complicated plants, you cannot physically enter the place. So you're sending a drone over there, which even may, especially on these petrochemical plants, sometimes you have 40, 50 meters above ground level. So you can send a drone over there to actually capture images. Even real-time work is also getting monitored using drones. So these are all the things that are really happening in going forward in the construction industry. Even training is also being done. Virtual reality is becoming a method of training for people. A lot of companies have come up with virtual scenarios where you sit in a room, you put on a camera or a box in front of in a visual kind of a screen in front of you, and then you watch the entire scenario, and you're able to see what is going to actually happen. And some construction sites have actually what we call it as augmented reality, brought in their own construction site and brought in the aspects which are used in virtual reality and combined it together to give a hands-on experience. So we find that this construction industry going forward is going to have a lot of automation as well as digitization. And both automation and digitization is actually going to improve the productivity of the projects itself, faster turnaround of projects, which is finally what is going to matter, because today everybody wants, I sometimes say that a contract is signed, and when is your delivery? When do you want it finished? Once I heard somebody who told me, we want it finished yesterday. Just to show that is something which is need to be fast tracked and got in place as very quickly as possible. So the construction industry is actually, the pandemic has accelerated the digitization and the automation side, and we as TCE also, we've also introduced a lot of digitization programs, smart site applications. We now almost all our sites are now connected by our own indigenously developed app called as Wrench Smart Site, and that is working quite well, and everybody's got used to it, and we've handed it over to our contractors. So the future looks good in terms of the construction industry to follow a no-touch economy. That's what the pandemic is actually brought in. So there's going to be a no-touch economy where digitization and IoT and automation will be at the forefront, driving the construction industry. But we have to always remember, these are just tools. But these tools are really going to be an accelerator for better delivery of various projects on our sites. So thank you very much.
Thank you, Joshi. Yeah, the technology was prevailing and always emerging, but then none of the industry have even thought of getting into so much of detail. But today, COVID has really made everybody understand that if you have to survive a next pandemic, you have to be prepared now. Thank you so much. And now moving to you, Navendu. While you touched upon a point of supply chain disruption during when you introduced yourself. We knew that the real estate or the construction industry is largely impacted, one due to the migrant labor and the lockdown, which restricts people traveling from one location to another. But supply chain is one of the larger area which has impacted the construction industry per se. When even if things goes to a normalization, but till the time supply chain is normalized, the recovery of construction industry to 100% doesn't looks to be a very easy as of now. Although it is not so difficult also, but then to ensure that we don't encounter this situation when the next pandemic comes, your organization must have started working on a proper recovery plan, so that tomorrow if something happens, supply chain is never a pain for you guys. So you create a very robust supply chain process so that the dividends are yield in a very profitable way. So what are your say to the audience in regards to that?
Yeah, being a coming from the owners organization, I think the COVID has actually increased the pace of digitalization. I
Except for today.
supplement what James and Josie has started telling to that actually. Scenario
Mr.
planning now.
Bhushan, your voice is breaking.
We
Can you
need to
please
understand.
repeat?
If our can you listen now properly?
Yeah, we can.
Yeah.
Is it okay?
Speak on.
I don't know about the rest of you, but I have problems with bandwidth. Every Saturday, I have problems with bandwidth because everybody is online.
Okay, maybe if you can listen, I do
Yeah,
not
yeah,
know.
we can.
Am I audible now? Can I
Yeah, yeah, you are very
continue
much.
or should I stop?
No, no, you continue.
He's getting stuck.
Yeah, yeah, there's a lag also.
So while we await Navindu to join back, I will come back to you, James. My question to you is, this COVID has also given a very broader sense of, security to most of the corporates. People used to take insurance, but nobody has even bothered to understand the nitty-gritties of insurance and indemnity. So now, when the COVID era still exists, and post-COVID era, what you think the organization should look for an insurance policy, when they're trying to create some insurance policy for their projects, what sort of parameters they should try to ensure that the insurance policy covers, so that they are well aware of the fact that whatever policy I take, at least these few parameters needs to be covered.
Yeah, this one is a big topic of discussion with a lot of people, and even the insurance companies, excuse me, are not quite sure what will happen in the future. So one of the things is that you're in the insurance changes that we're probably going to see are in contracts when they talk about disruptions. Now, right now, most of the people who are trying to make claims for scheduled disruptions and everything are using a force majeure clause, which is outside entities or outside actions come in and cause some of the problems. But a lot of the insurers are reading this as an act of God, like they would a weather event or something, and some of them they were actually refusing to pay. Now, the force majeure is challenged by a lot of exclusions, so I think that in the future, the contract language is going to be much more defined. You're not going to have as many broad-based coverages as you did in the past. It's going to be much more detailed. The pandemic is changing mindsets. I mean, the predictions are tough, especially the fiscal predictions. But one of the things that we see, while the policies are going to have to be much more detailed, we're actually going to see some simplification in the documentation, which is, like Josie said, a lot more of it's going to be digitized. Now, in the past, when we issued claims or we had claims that went to the insurers, there was a lot of paperwork involved. There were a lot of actual signatures. Paper got transferred around. There were drawings that were attached, photos, whatever, and you would send it in packets. And that would go to a claims manager, and a claims manager would handle that. So what I see coming is a lot of this is going to be digitized, that we're not going to have as much of the paper trail, the actual physical paper trail going around. Now, SARS caused some insurance changes too. I mean, a lot of people saw that, and a lot of the policies do have exclusion clauses. But the interruption policies normally only pay when there's physical damage to assets or operations. It usually doesn't pay for the schedule in the problems. Now, in general liability under compensation, we're probably going to see a rate increase. There have been so many billions of dollars in claims. Like one of them I read was that the Tokyo Olympics has been paid over $5 billion in claims already, and they're dragging their feet on about another $10 billion. Between the various insurers that they had for the various events and hotels and things like that. Now, while we might see that, one of the things that we have to look at is what's called DSU, or delay of startup. And in this, it's going to have to be itemized, because delay of startup cases are usually because you have a lack of equipment, or you have a lack of material, or you have a weather event that comes in. But in these DSU cases, it's going to be more itemization too. It's not going to be as broad-based. Another thing is that we have to look at what's called advanced loss revenue. And advanced loss revenue is on the owner's side of it. And, we're very unique that we're owners and constructors. I work kind of on both sides of the fence. But the advanced loss revenue claims, once again, it's going to have to be much more detailed. And I think that what we're going to see is in a lot of these cases, like DSU and ALS, you're going to see exclusions that they're going to say flat out, communicable diseases are not part of this insurance policy. In fact, we're starting to see that in insurance policies now, that there's defined language that says communicable diseases, even if they're black swan events, are not covered in a lot of cases. We can expect to see that. But another thing that's changing is the workman's comp aspect. And in workman's comp, it's going to have to actually, the burden of proof in the past was basically on the employee. And I see what the
Going off
burden
and
of
on.
proof now is going to be on the employer. We're going to have to prove in a lot of cases that they didn't get the disease at the work site. And this is going to be very, very difficult, particularly in light of the changes that we see with the regulatory side. Now, on the regulatory side, you have US federal OSHA, the EU OSHA, and a few others that basically kind of took a hands-off policy to the whole COVID thing. In fact, US OSHA came out and said, you cannot make a job-related claim unless you are a first responder, a policeman working in a hospital, et cetera, et cetera. Well, now they're easing up off of that. And now what they're doing is they're saying, okay, burden of proof back on the employer. So if you have an employee that shows up and he's positive for COVID-19, we're going to have very good documentation. We're going to have a lot of front side work that shows that we did the best effort possible. And then in the particular case of that individual employee, here are the steps that we took. It's going to be a burden of proof. And like I said, I see that burden of proof coming back on us. And it's something we're going to have to get ready for. Now, I did find out a little bit in some of the research I was doing about this is that you hear in India, they're starting to sell 2 different personal policies to people. And I see people buying these personal policies to cover themselves. Now, you know, the migrant worker like Josie was alluding to, you know, the guy that comes from, you know, he's a fisherman in a village and he comes to work construction for a season. I don't see him buying these kind of policies, but some people will. One of them is called Corona Kavach, which, you know, Kavach means shield. But anyways, it's a standard indemnity policy. Basically what it does is it covers everything. It covers all diseases. It covers everything. It will cover the corona, but the premium is going to be quite high. The second one is called Corona Rakshak, which is fixed benefits. So it is going to be itemized. It's going to say you're covered for this, you're covered for this, you're covered for this, you're covered for this, and that is all that it will cover. So we're seeing these 2 kinds of personal policies being sold. And I think that what's going to happen is a lot of the general policy or the brokers and a lot of the underwriters that we deal with now are going to try to follow suit when they're seeing what's coming on out there. But like I said, you know, the simplification of the documentation, but the burden of proof is the one thing that I think is going to be one of the biggest changes that we have. So that means a lot more footwork. And where that comes back to is it's this. It's not just the amount on the insurance claim that we pay out on the injured worker. It's what does it do to our experience modifier? What does it do to the anticipated claims we have versus the claims that we actually file for? And if our experience modifier goes above a number of 1, it's a guarantee that premiums are jacked up the next year. So I'm really curious to see what is going to happen with premium costs in the upcoming year. Word I'm hearing is they're going to be greatly increased if they have pandemic or communicable disease coverage. A lot of construction companies and a lot of our contractors are going to choose to take the cheaper policy. Now, this is something that we are going to have to work with contracts on. And we're going to have to make sure that our people in contracts that let these contracts out to these subcontractors have the proper coverage. Then we're going to have to do more investigation on their actual insurance policies, or we're going to have to have an OSIP. And an OSIP is a policy that's put in place by the owner or by the general contractor that covers everybody. It's an owner-controlled insurance policy. So we may see a change toward that. Now, self-insured companies like ours is self-insured. I don't know what the changes are going to be. I don't know how we're going to change language or whatever. But what concerns me is how is this going to impact the smaller contractors or the medium-sized contractors that work on very narrow profit margins already? Some of them may actually go out of business. Some of them may try to get by with no insurance. So we're going to have to be much more diligent in our due process when it comes to the contracts. And we're also going to have to review our actual PQQs, our pre-qualification questionnaires. We're going to have to add some things in there about insurance coverage and about pandemic coverage especially. So I see a lot of changes coming. And like I said, it's a big topic of discussion in the industry right now.
Fine, Jen. So you mean to say when we float an RFP, you will have a specific clause related to insurance, and you will do a proper due diligence of the documents when you assign a contract to ensure that the organization is well protected against the perils as well as the indemnity by the proper insurance company. Even if the organization has to pay a bit of premium to ensure that they get indemnification for that, so as to ensure that they are not exposed to any kind of recovery cases which can go against them under the common law.
Yes. In fact, when I worked for Aon, we had a saying. We said, "Prove it or lose it." Basically, you prove that you have it, or you lose the coverage. And so, I see a lot of that coming.
Thank you so much. Coming to you, Josie. We all know the pandemic ends and we see a new world together. The marketplace is going to change, the portfolios are going to change, and there will be a lot of emphasis on the sustainability and resilience. Cities are required to be serving to the more of a residents who are going to work from home, and there are going to be a greater investment which is going to be pumping in by the developers, because today your residents are not designed, or they have the required infrastructure to take care of the work from home environment. Although many of us are working from work from home, but then there are several challenges which we are facing. So what you see a vision of a construction company would be when they create a new home or a new design, considering into fact that yes, work from home can be invoked anytime and at any given point of time from anyone. So to ensure that every flat is equipped with a work from home capability, so how should be the apprehension or the approach of the construction company should be towards it? So what should be your opinion as a developer or in a construction company?
Yeah. Thank you, Abhijit. From what has been evolving over the past few months, working from home has become a reality. And Tata Consulting Services, the biggest IT services company, has already declared by 2025, only 25% of the people will be going back to the offices. 75% will be sitting at home. So there's going to be a lot of office space which is going to be available. So my personal opinion is you don't need any more new office space. Kind of commercial real estate demand is going to come down. But any new residential project which is coming up, I would even say that if the developers can even devote one whole floor for an office space, would be a very good idea, because it's going to have people from that entire, maybe you might house about 400 apartments there, have a couple of floors in a few buildings, have it there, and have a dedicated office space available, fully furnished, fitted out with the best of internet Wi-Fi services. And you can have a plug and use way of looking at it. People can buy up time in that office, go sit there, and you'll be next to you, within your own premises itself, 5 minutes away. You don't have to even actually do this at home. You can just walk across to that building over there, go in there, whichever time you want to spend over there, work, and then you can go back home. And you can space out your time. I don't know I just hope that some of the builders would actually come up with this idea, because that's going to really sell with organizations when they're going to have when the return to work, or maybe after this financial year, things will change. One of the ideas that which I had also suggested in another forum was work near home. The government itself can come up with, what we found is that people who have come from the rural areas, most of them have gone back to their own hometowns, whether it's a small village or a bigger town from the big cities. You find there's a lot of apartments for rent available in many places now, because people have just gone back to their homes. Government can actually, go into these smaller towns, set up a kind of a chain of places, these kind of common workstations or workplaces where people can come together from that particular location, and they go back to their homes. Another thing which has been proposed, which was discussed in the context of Kerala, was a lot of engineering colleges are there. There's about 175 of them. Most of them have found that the number of students have come down, and they found that there's plenty of space available. You can easily house at least 500 or to even 1,000 people in many of these office spaces. So if they in these buildings, so if they can convert this also as a place for work, those who have invested money in that have a ready-made opportunity to generate an income. And being a college, kind of a situation, and these colleges are not just concentrated in the cities, but even in far smaller towns and villages. Even they can even have a common cafeteria. The old kind of a working environment could also be generated. So there are so many different ways of looking at how to actually cater to the need of the industry, especially the real estate business. Because I told you, real estate is what actually drives an economy, and different models would have to be looked at. And Dr. Abhijit is very much involved in this industry, and so I would say he's one of those people who think about the industry very much and see how to take this forward. So this is what I feel would be the way forward in the post-COVID era. Thank you.
Thank you so much, Joshi. I come back to you, James, again. As we touched upon the point of health and wellness in detail, but we are all aware that fundamental like OSHAs and all are still not followed by many of the real estate or a construction company. So, what you think? What would be your advice to those companies that they should try to use the parameters or benchmarking, because we will definitely see that in going period of time OSHA has also come out with new guidelines to take care of this kind of situation. So what do you think people the construction industry should aggressively adapt to this kind of mechanism of OSHAs for their people who are on site as well as off site? So what is your suggestion to the industry?
Well, I think that we're going to see a few changes in the next year or so. I mean, in the regulatory cycle, normally it's the odd numbered years when you see changes in regulations. Now, here in India, just in the last year or this year, they actually took all the different labor laws that were out there together and tried to codify it into one set of laws. But it's still not as detailed as a lot of others. Now, I do think that a lot of people are going to follow the lead of US OSHA and EU OSHA when it comes to this. And we have to be prepared as best as we can. So a lot of this, it's depending upon a lot of the legislation that comes out there. And I think a lot of the legislation will be driven by some of the claims and maybe some of the failures or some of the successes of the business. Give you an example. Josie was talking about office space and everything. I mean, our company, we were about to launch the opening of 2 towers that were 27 stories each on our main campus. They were designed for 8,000 people, but they had come up with a concept called hot desking where they were going to put 12,000 people in these. Now we're looking at 4,000 people for both those buildings. But it goes back to the work from home thing. So that is where it's going to become tricky, because these regulatory agencies have some very loose rules about occupational safety and health laws, rules, and regulations in the work from home environment. And I think what's going to happen is we're going to see that there's going to be more attention paid to that. There's also going to be more attention paid to the claims that are generated from that. There's also going to be more attention paid to the basic health and welfare, the basic industrial hygiene. Do we provide respiratory protection? Now, I'll give you an example, and this is just theoretical, but let's say that a company tells its workers, you've got to provide your own face masks, and then there is an epidemic or there's an outbreak or something. Well, because they could say that that's a personal piece of clothing, that it's actually an article of clothing, that it's not considered PPE, and then they could come back and get into a dogfight on that. Mm-hmm. The way I see it is we're going to have to budget better too, to keep out of regulatory problems, which means a lot more upfront spending, a lot more analysis on what we're going to have to do. And that means we have to be very wise with our purchases and how we do this. And that dovetails into the education. And it all goes back, at the end of the day, it comes back to how does that affect us fiscally? And, we already have all these interruptions. We already have all these increased costs and everything else. I think that right now, with all the attention that's being paid on this is the time for us to move forward with our ideas and our plans about improving the job site and improving the way that we actually factor the cost into these up front. Normal construction, safety gets like maybe 2.5% of the budget. That's about it. I think in the future, we're going to look at a significant increase on the amount of money that we're spending, 1, to keep our people safe, 2, to stay out of litigation, one way or another, whether that's coming from regulatory agencies or that comes from an individual or a company that takes us to court saying that we provided an unhealthy and unfriendly and unsafe workplace. So, another one, it's a great unknown, but I think that we're going to actually see more specific legislation. I think we're going to see more specific language and more specific laws when it comes to health and welfare. I really do. I think we're going to see more of it, and we better be prepared.
Yeah, you're right, James, because today we see that, most of the organizations really spend huge amount of money irrespective of what the regulation says. And whereas the rest of the organization just try to ensure that they comply with the regulatory norm. That's it.
Yeah.
Irrespective of fact that, a simple example of, workstation, many organizations still consider to be, 100 to 150 square feet as a benchmark for their employee, whereas other organizations really consider that 50 to 60 square feet is more than enough, because they are more inclined about their real estate value. So definitely there has to be a intense regulatory norm that has to come, because at the end of the day, the discipline will come only when there are regulatory changes. Otherwise, COVID will go and people will forget what has happened. So it's very important that a regulatory change happen. Navindu, so if you are able to listen to us, why didn't you continue the answer we started? Navindu, are you able to hear us? Okay, I come back to you, Josie. The construction company, what you think, now should think on investing on the effort to create and increase the resilience of the business models, and focus more on plug and play models, like, prefabricated ducts and utilities, and to ensure that, anything coming out in future is definitely won't lead to much of disruption for this construction company. So what is your opinion to this?
Uh, Construction industry is always changing, new technologies come in. Now, for example, precast is slowly getting a little more popular than what it was. In India, the challenge with the precast was we had a huge challenge in handling. If it's a very heavy precast sections, if it's coming from a plant, the roads are not prepared to handle that infrastructure. Then onto a construction site, also we have an issue. In Mumbai, there have been a lot of buildings which have done using precast, but now there are some other companies which have actually stepped in and accelerated the whole process. So, for example, in a precast construction, you already have the electrical ducts in, everything is is already fitted in. You just need to come and finish it off. And I've personally also I've worked in the precast industry while working in the Middle East, where we are producing 300,000 square meters of panels every year. 3 million square meters of panel every year. So huge numbers. So it's very common there. And for example, you can even have pods which can be dropped in for using a crane, so that it is already there. So the interiors do not have to be done at all. You just straight away go in with all the plumbing, and the electrical lines are already there. So precast industry is going to be quite popular. And we ourselves, TC itself, are actually, there is one of our major clients who is doing a lot of work using precast technology itself. One of the things they wanted us to come up was to have a precast design for building something known as a Nandgar in different villages in the northern part of India. And I think the client wants us to put up about 4,000 of them in different locations. And because of the size of it, you cannot mobilize a huge construction crew over it. So when you have a precast, it's just 2 or 3 trailers which come in and it gets knocked into place. So these kind of technologies are also coming in. Even in high-rise buildings also, we do find a lot of precast elements are actually being used. Floor slabs are being used, precast elements. Even now, pods can be, bathroom pods are also being fabricated, and it just gets dropped in, and then the whatever you need to do all around it. So precast I think after COVID, is going to accelerate. And with the government of India going with this PMAY, as they call the Awas Yojana program for all the states, there's huge investment coming into mass housing. And mass housing always requires quicker delivery of the project itself. And it is, since there's repetitiveness, you're going to find a lot of precast coming in here. In Mumbai, the CIDCO is actually spending about 20,000 crores, and they're putting up about 170 buildings of various sizes, even up to 44 floors high, which is going to be part of the mass housing. So we are looking at the possibility of having precast kind of elements coming into there, so that the whole process gets speeded up and accelerated. And therefore, when you accelerate the process, you're actually, the overall costs come in, both direct costs as well as indirect costs. So that's going to be one of the factors that is going to come up in the post-COVID, as well as in the future also. Thank you.
Thank you, Josie. While I conclude this session with the final round of questions, it is to both James and Josie, both of you. Navendu, are you back? Okay, so I just wanted to understand from James and Josie, as we spoke about a lot that COVID has impacted this industry and what kind of, resilience plan most of the organizations would look upon, including the insurance factor and other apparently, other factors as well, bringing technology into picture. So now, as an individual, both of you, what you think, your personal experiences that COVID as a professional, you have learned and, thought that at least I will ensure that these disciplines are being followed. So what would be your say to that? First, James, I would start off with you, then maybe Josie can answer.
Well, I tell you, as an individual, fortunately for me, I had a work from home schedule at one point in the past. And so I was a little bit more prepared for this than a lot of other people were. But one of the things that is difficult for me as an EHS professional is the fact that I have not physically been on a job site in 7 months. I haven't seen one. Now, the use of telecommunications and the use of drones and things like that. I mean, I do see a lot of positive use for that, and I do see that we're going to change that. We're going to go toward that in the future. But at the same time, there's nothing like boots on the ground. There's nothing like walking around and using your peripheral vision and seeing people in action. The act of being observed changes the behavior of the person who's being observed. And so the fact that we're not there physically means that there could be a few things that are being done out of sight of those cameras or on hours that we're not actually recording or whatever. So I think that is going to be a real struggle for us in the future. I really do. It like I said, once again, the great unknown, so many things. It's so hard to predict what the future is going to hold. But I do think that we're going to have to change a lot of our personal habits. I like what Josie said about, people having to, people taking jobs that are closer to home, et cetera, et cetera. I see people who are going to be looking at reducing commute times tremendously. A lot less, people who are going to be, like I said, like shift workers. I mean, we're going to have to look at adjusting shifts. There's just so many things we have to do. It's really hard to put a pin on it, but I do know that change is coming. And there was a saying that was made many years ago by a patriot during the American Revolution. He said, "We better all hang together, or we will most assuredly all hang separately." So we're going to have to come together as an industry. We're going to have more information sharing. We're going to have to work together more on common solutions to the answers, because this is a common crisis.
Yeah, just to add, if you all can listen
James.
me.
Navindu, are you able to listen to us?
Yes. I could listen most of
so I
you,
would
but I could not talk.
Continue with the. So my request is to continue with the question with the answer you left.
Okay, regarding the supply chain, I feel so it is going to be a global scenario planning. We have already started with multiple projects here. We are not going to put, the contracts are seen to be that all the eggs are not put into the same basket. We were importing a lot of things from a particular country or particular zone or particular state or vendor. We have to see that we are going to the multiple places, so that the risk is mitigated, risk is uniformly distributed. We have to also see the inspections and all. In supply chain, a lot of inspections we have started doing already online. We have advised our fabricators to install some cameras so that we can see the things online, rather than moving here and there. So those things have also started. Technology is going to influence a lot of things. We will have a lot of learning since coming 1 and 2 years, and after that only the final formalization will happen inside the industry. But the things like internet of things, robotics into the complete picture, involvement of 5G into the coming thing, virtual reality will influence a lot. What will influence a lot. So my take on supply chain is that yes, it will have implication of IoTs, it will have implication of digitalization, contract management, and the risk mitigation by uniformly distributing the risk into the different regions. Regions can be countries, regions can be states or different vendors. So that is how we are going to move into that. Thanks, Abhijit.
Thank you. So now, before I move to Joshi, I just wanted to take your view that what lesson as an individual or as a professional you have learned from this COVID.
I think we have to, in short, we have to see the empathetic view towards the labor community. That is must to see, because laborers who are, mostly affected due to these things. We also need to understand, the productivity charts will vary now. It will go up because of the digitalization and the measures which companies are taking. Whether it is prefabrication, modularization. Like Joshi was talking about the prefabrication. India is still far behind in prefabrication industry compared to other parts of the world. We will have a lot of implication into this, and we have already started in our organization. We have started with a lot of modularization, so our chemical plants can be modularized at particular workshop, and whole plant can be transported together, something 3000 ton and 4000 ton. So that way the thoughts have already started. In some places we have implemented in the smaller scale of 500 to 1000 metric ton of the complete smaller plants. We have already done that. So those activities will get started in the long term to come.
Okay. So now, finally, I would come back to you, Joshi, for your view on what as an individual or a professional you have learned from this pandemic.
Pandemic has taught a lot of things. There's a lot of
Now we have
uncertainty
frozen
in human
Josie.
life. That's the first thing that I could realize, because anybody can be affected by this virus. I'm frozen. Am I audible?
Yeah.
What has happened is you have even global leaders and down to the last person in the food chain can also be affected. So the virus doesn't distinguish between people, and everybody and anybody can get affected by it. Now, being in the construction industry, construction and safety, it's all about visiting sites, spending time with them, talking to people. So two things that has come out is I've been able to interact with more people now thanks to the extensive use of Microsoft Teams. Earlier, it was mostly the people in office and based in, but now all our sites have also got fully engaged. Therefore, we have a lot of training which could be done on Microsoft Teams. That's training. Then another thing which I got very actively engaged in was doing inspections on Microsoft Teams. So we will always have a meeting in the office, and then a couple of guys will go out with their phone and their camera switched on, and they will be moving around, not on a conductor to what they want, but on what I want them to show me. Because sometimes when you do safety inspections, they will ensure that only the places which are very presentable will be shown. But I told them I will decide where I want to go. So that used to be a 1 hour exercise, and that has proved very, very beneficial. We could you never feel that you've been away from your construction site, and these are the two aspects of the pandemic which has actually changed the way of working for me personally. And the organization has also benefited because of that. There's more engagement of people. That's what I think, even through this, through using Microsoft Teams or any of this digitization platforms. So things keep changing. You need to adjust yourself to the change and accept the reality, and you have to move forward. The world has changed. If you don't change along with the world, you will be left behind. And I do not want to be left behind at all. Thank you.
Thank you. Thank you so much to all the panelists for the wonderful insights which you have brought to this session. And while I close this Q&A session, my Q&A session and open up the Q&A session for the audience. So I have got the first question coming from the audience who says that, since the costs are going to go up, so how are the builder going to manage? Are they going to squeeze their profit, or are they going to load the customer for the cost going up? So I would like Novendu and Joshi both giving their view to this, because you both represent the development side.
See, in terms of I will talk about the industry terms. Definitely, some cost is going to go up. As an owner, we need to be ready for that, at least for the short term. In long term, it will also have implication of digitalization coming into the picture, and actually, it is going to nullify the incremental cost which is going to come due to the COVID. So in the short term, we have to start seeing in a holistic view. Contractors or the builders need to understand that yes, if they have to reduce their margins, they have to reduce little bit of their margins. Or as an owner, we also need to understand the holistic view of that. And there will be some implication on the cost. So there will be some additional cost due to the COVID, which is going to come into the picture. But in the long run, I do not feel that it will have overall implication or incremental cost increase. It will actually, by virtue of bringing digitalization, modularization, prefabrication into the construction industry, I feel that overall there will be a limit where we will see the advantage more rather than disadvantage. Over to
Okay, so
James.
Joshi, to you, I will like to add few more thing to this question. While we say that the costs are going to go up for sure. So now, if the developer doesn't compromise on absorbing the cost, or if he feels that partially he will bear and partially he will load. So what do you think the load is going to encourage the buyer to come ahead and buy, or they will still wait for some more time to ensure that the cost goes down, and then they decide on their strategy. So how you think this situation is going to change in future?
Now,
See,
I
for
want to make a distinction between cost and selling price. Cost is actually all the inputs that have gone into the project. Now, then it depends upon the real estate developer what markup he wants to put up for the selling price. And that will depend upon the kind of a place that he's in, what is the premium that kind of property actually brings in. Now, with COVID coming into place, there will be some additional costs. Whether that, as you rightly said, whether cost gets absorbed in the selling price is to be decided. A few years back, I was talking at a BAI Kradai seminar, and they asked me a question: what is the cost of safety? And from my experience that I've had in the construction industry, and from the exercises that we've done in the previous, in some of the projects, this was when I was with L&T, we found that the cost of safety was, specifically the safety was anywhere between 0.75% and 1.6% of the total project cost. So this builder immediately said, well, that means he said, I'm selling my apartments. This was somewhere in South India. He said, I'm selling it at about 4,000 or 4,500 per square feet. And you're talking about only about 1% increase. I can just even raise the selling price of my per square feet by just about 1%. That's about 40 or 50 rupees per square feet. And the buyer is not going to get very much affected. Somehow there is a kind of a narrative created that there's going to be a huge increase in the cost. Therefore, we have to increase the selling price. We have to have a realistic approach to this, because at the end of the day, we know that the economy is badly affected. The money is not changing hands. Everybody needs to understand this and take measured decisions so that everybody is in a win-win situation, because everybody wants the business to survive. Everybody wants a job. People need to put food on their table. So cost and price, these are two elements which need to be looked at. Costs have to be contractors. In fact, I would even say that they are even reducing the quotation which they're submitting, because they feel now that they don't have much work. The tender prices are also have started coming down. So I don't think builders will have a problem. They now have to decide how much of markup they want to put in selling out their property. Thank you.
Navinder, you wanted to add something?
Yeah, I just wanted to add that that finally seller, we have to also see this, the buyer's mindset. In this COVID situation, how many people are wanted to invest money now? Seller has to ignite that feeling, and to ignite that feeling, if they wanted to load just because of the COVID, that will not have a good, perspective in terms of the buyer. So they have to balance between both the things, that how much they wanted to add the value due to the COVID, per se, selling more things. If they hold the complete things for 6 months, I think that will be much more loss compared to selling it now without adding to the margin of the COVID-19. So that's what my perspective as far as real estate is concerned.
Okay, so now while in wake of time, we have hardly 4 minutes left, and there is a final question coming up. So I would like to ask all of you a short reply to this. The audience want to know when we can see the real estate or a construction industry coming back to a normalcy, and apparently the small time developers, are they really inclined to spend on technology at this juncture or in future? So what would be your say of all three of you? Josie, I start with you, then James and Novindu can take it.
See, builders as well as contractors, they have to accept the fact that technology is here to stay. As I told you in my earlier it was all manual construction, then it got into mechanical, then the introduction of computers. It has all been accepted and absorbed by the economy. So there is no point in saying, no, we'll go back to the old systems, we'll go back to the pre-COVID days. COVID has brought about some changes that needs to be taken in, the costs need to be looked at, and we'll have to go forward. Actually, when you're going for digitization and automation in the construction industry, you will find there are certain costs, that the productivity goes up, therefore the costs will also come down. So it is how efficiently you're going to manage your resources is what is going to give you the advantage. And that every builder and every contractor is looking at it in order to keep their costs down as well as improve on their profitability. As I told you earlier, tender prices have started coming down. That means already contractors have started looking at it in terms of benefits that is accruing to them.
So another element to this is when do you think that the construction industry is going to recover? See, it's already partially in the verge of recovery. We don't say that construction activity has not started, but there are still a lot of barriers for construction to begin in the full swing. And whether the developers, the other developers are in a mood to start the construction at this juncture, considering the buyers' sentiments and all. So, what do you think? What is the timeline you see for this industry to get stabilized?
The infrastructure industry is almost 100% back on rails because I told you we are involved in so many projects across the country. So almost all the infrastructure projects are back on stream. Even if you define, you would even see how the government, like for example, the bullet train project, they've announced the lowest bidder. A lot of these metro projects a lot of road projects are back on stream. So when all these projects happen, there is money moving in the market. And so by default, the real estate players also will start, this gets trickled into them, into that sector of the business also. So I would say give yourself another 6 to 8 months to actually see private investments coming back into the real estate market. And with the interest rates from banks coming down, people will be interested in buying homes. So maybe there was an oversupply at one point of time because you are able to handle your money from one project. You could get some money taken into another project, and people started diversifying in so many areas. But now there's going to be some kind of a regulation or a self-regulation which will come in, which will ensure that those who are really good players, not fly-by-night operators, they will not struggle. Because even today's newspaper, I was just looking at, well, in Pune, there's a lot of full-page advertisements. At least 4 or 5 full-page advertisements of builders are there. So that means the real estate market is coming back in place. So that's a very good sign. I think the real estate market in the residential sector is really going to pick up in the coming future, maybe after 6 months.
Okay, James, to your view to this, and finally Navendu to close with your views.
Yeah, really fast. Digital technology is a tool. And like any industry, you can't work without tools. And also, another thing is technology costs are coming down. I mean, it's like anything. Like when a new type of TV comes out, it's very expensive at first, but the more that it's manufactured, the more that it's sold, the more the costs come down, where it's affordable. I mean, I remember when computers first came in, nobody had a computer except the project engineer and the project controls guy and the project manager. Now everybody has one because the costs have come down and we've seen the use of it. But another thing is, and to think about this in a historical aspect, in the 1820s, the Industrial Revolution started. A lot of companies went out of business. A lot of companies embraced the change. They invested the money. They went forward. In the 1920s, the internal combustion engine revolution came in. Same thing.